Hi, I'm Jonathan Staiano. I am a consultant plastic surgeon and I run the Staiano clinic here in Edgbaston. So, breast reduction. A lot of people ask what size they're going to be after a breast reduction, and we can never really be too committal on that. And sometimes patients think, oh, you're being a bit cagey because you're not really telling me what size I want to be. I want to be a D cup, or I want to be a C cup, or whatever. Sometimes patients have got quite a strict vision about what size they want to be, and we'll always say, look, we'll take that on board, but we can't guarantee it. And the reason we can't guarantee it is because, firstly, bra cup size is not a precise science, and you will find that there are different makes of bra where you will fit different cup sizes. And secondly, the back size can change. So sometimes people can come and be a 34B, but then you might also be able to wear a 32C. By making a smaller back size, you wear a bigger cup size for the same size of breast. So cup size is not a precise science, number one. But perhaps more importantly, specifically with breast reduction, we can never guarantee the cup size you're going to be, because we don't have something in theatre that says what a C cup or what a D cup is. A C cup and a D cup is different on different bodies. The cup size is related to the difference between your back size and your bust size. So someone with a bigger back will have a different size breast and still be a C cup than someone with a smaller back. So we don't have a specific template or a mould that we can say what a C cup or a D cup is in theatre. And the really important thing when you're doing a breast reduction is, number one, you've got to keep the nipple alive. You're moving the nipple from a low place to a high place. A lift is part of a breast reduction. It's an integral part of a breast reduction. You always perform a lift when you do a breast reduction, because not only are you removing the volume, you're also removing the skin and tightening that skin in the same way that you would with a lift. But because you're moving the nipple, you have to keep a certain amount of volume going to the nipple, and that carries with it a certain amount of volume of breast tissue. So the bigger you are before, the bigger you'll be afterwards, because the longer your pedicle will be, the longer that stalk that goes to the nipple will be, and that will carry with it a certain volume. But also, we need to give a nice shape to the breast. People often say, I want to be as small as possible, or I'm really fed up with the enormous breasts and the bra straps digging in, and I'm getting lots of symptoms from the rashes in the fold and what have you, and I just get rid of them. But you have to give a good shape to the breast. If you over-resect the breast, if you make it too small and it lacks projection, you won't be happy. So we need to make sure that there's a certain width to the breast and a certain projection to the breast to give a nice shape to the breast in keeping with your frame. So that's really what we're focusing on when we're doing a breast reduction. We need to keep enough blood supply and nerve supply going to the nipple, which will carry with it a certain volume, but we also keep a nice shape to the breast to give it a pleasing shape with the nipple at the apex of the breast, and sort of pyramidal shape so that you have a nice projection to the breast, and it's in keeping with your frame. So we can't guarantee a cup size, and all we can really guarantee is that they'll be smaller, and we'll guarantee that they'll be lifted and give you a shape that's in keeping with your frame. So we're not being cagey, we're not trying to be unhelpful, we will take on board your wishes when it comes to cup size, but we can never guarantee it, but we can guarantee they'll be smaller and they'll be lifted. So I hope that's been helpful.